Hello, welcome everyone. So my name is Anwesha Mukherjee. So today I'm here with live with Dr. Vaishali Sukla of BAMS. Today we are going to talk about Leucorrhoea and Ayurveda. So just waiting for some more people to join and waiting for Dr. Vaishali Shukla to join us.
Hello, hi.
Welcome ma'am. Just so glad you're here.
Hello, I'm so glad you've called me here. Am I visible? Am I audible?
Absolutely. Absolutely.
Okay, okay. There was a sudden power cut which happened in my place, but then I thought maybe it won't come, so I was about to go to the terrace, but then it came. It's just good. Okay.
So
All right.
I think this person needs no introduction because I think everyone knows Dr. Vaishali Shukla. She is
Hmm.
specialized in Pancakarma. I think I don't need to give any introduction of you because you're very popular in among the
Oh,
Ayurvedic in the Ayurvedic field actually.
okay,
So
I didn't know that. Although, if there are many more practitioners who are working extremely well, I'm just trying to do my bit. But I'm glad that you guys know me
you are
already.
very very popular, very popular.
All
You will
right.
not know. You such a pretty doctor. Everyone will know that.
Oh God. Thank you. So are you? Thank you so much. I'm overwhelmed for after your introduction. So thank you very much.
Yeah. So today we're going to talk about Leucorrhoea in Ayurveda. So first of all, I would love to ask you that if you tell the Leucorrhoea correlated in Ayurveda, means what is Leucorrhoea called in Ayurveda?
Okay. So, see, when we talk about leukorrhea is a very simple term where we talk about the vaginal discharge. Leuco means white, rhea means discharge. Okay. So, leukorrhea is white vaginal discharge, which is happening. When you talk about Ayurveda, we talk about pradar. What is pradar? Pradar again is discharge, where there's excessive flow from the vaginal area. That is pradar. When you talk about leukorrhea, it is shweta pradar. When there's whitish discharge, which is happening from the vaginal region, that is called as shweta pradar. So that's a simple translation of what leukorrhea is and what it is called in Ayurveda. But when we talk about leukorrhea, it's very important that we understand that all leukorrhea is not something which is abnormal. So because leukorrhea is pathological and it's physiological. So if it's physiological, that means it's not, it's completely normal. You don't have to, it's not worrisome. Nobody has to worry about it because every female suffers or, has leukorrhea to some or the other extent, which is physiological leukorrhea, which is completely natural. We're going to talk about that in the later part of the session. And there's pathological leukorrhea, which is not normal when there's excessive discharge. So Ayurveda also classifies this into four types, which is Vatik, Pittik, and Kaphaj, and then there's Sannipatik. which the layman would not understand, but you being an Ayurvedic doctor yourself knows what exactly it is. So there are, divisions according to doshas, and Ayurveda has particularly also described the type of discharge that you get, along with the color, the consistency, the thickness, the viscosity, volume, everything. Ayurveda has given, even the tiniest details when it comes to Shweta Pradar or any sort of Pradar. So even in the Shweta Pradar, which is described according to the doshas and then one Sannipatik, Ayurveda has given, complete detail about leucorrhea. So that's a brief introduction of it, if we talk about of it in the journal term.
So I would love if you. You're
Am I
not
visible?
audible.
Now, am
Yeah,
I
yeah,
audible?
yeah.
Yeah.
Now you're audible.
Okay.
I would love one thing to ask, that is, how will one understand that it is physiological or pathological euphoria?
Yeah, so I have seen a lot of girls in my practice who do not understand what is physiological leukorrhea and what is pathological leukorrhea, and it's something which everyone must know about because it's a tiniest detail. So when I take female patients, or when I consult female patients, I ask them to I first take the test, so that I understand what all things do they know about their body in general, and whatever they don't know, then I educate them about themselves, because female body is something which is complicated yet so beautiful. Okay, because we
Yeah.
go through a lot of incidents altogether in a month, in our life cycle, because we go through just a, we go through a lot of stuffs all together in a month. We go through the menstrual cycle, then we go through PMS symptoms, we go through pregnancy, deliveries, postpartum depression, hair fall, and everything. Then we go through menopause. So female body is something, because there's constant hormonal flux which is happening in female body. We must understand every bit of it, whatever. Even the layman who does not know anything about the medical terminology must understand, the basics of female body, of, being a female herself. Every female must know this. So talking about the, physiological discharge and then the pathological discharge. A physiological discharge is something which can happen before or after your period cycle. So if there's, tiny bit of the whitish discharge which is going, or even a little more than the normal, if it's going before or after your period cycle, it's completely normal. A discharge which is odorless, so there's no smell attached to it. A discharge which is not causing any debility, which means which is not causing any sort of fatigue, which is not causing any sort. This is what the modern science does not say, but then Ayurveda describes this. This is the beauty of Ayurveda. So modern science does not tell you about the debility which you get with the whitest discharge, but then Ayurveda tells you. So if this discharge is not causing you any sort of debility, no fatigue, no weight loss, and it's not causing you, lower down energy levels or any other complications that way, it's completely normal. A discharge which has no color, and a discharge which is, with consistency. Am I visible and audible? Yeah. So, no, that's okay. So a discharge which is of normal consistency, which is not hampering. So no odor, no color, no itchiness, no discomfort, no burning sensation. I think there's something wrong with the network, because your video is paused. Can you?
Am I visible now?
Can someone from the audience tell me if everything is okay?
You're visible. Actually, doctor, you're visible to me,
I,
and you're audible also to me. Am I visible and audible? Um,
something is wrong with my network or what? Can someone from the audience tell me if they can hear me? Or
I can hear you, doctor.
Am I visible?
Yeah, you're visible. Am I visible,
Am I
doctor?
visible and audible now? But
Am I visible?
no, your video is a little laggy. Something is wrong with my network. I don't know.
Um, I think from the audience they are telling that both all right.
Okay, all right. So what I was saying is, so what I was saying is any discharge which has no odor, which has no itchiness or no burning sensation, no discomfort, which has no thick consistency, or which is not curd like, is completely normal. So that is a physiological leukorrhea. That's normal whitish discharge. And anything opposite to that, so anything that has discomfort, anything which is causing debility, anything which has itchiness, or anything which has burning sensation, profuse whitish discharge where you have to use panty liners, or where you have to use pads to work on that, is not normal. So that is where that is where we can put all these things in the Pradhara category, or the pathological leukorrhea category. Anything apart from that is completely normal. That's physiological leukorrhea.
So I would love another thing to ask you that means a girl who is having leukorrhea, then what is the do's and don'ts of leukorrhea, or the prevention of
Okay.
leukorrhea? How can a girl prevent from having leukorrhea?
Okay, so before talking about the do's and don'ts, let's just talk about the causes of it first. Because according to the modern science, again, there are no causes of leukorrhea, or there's no particular, it's idiopathic. But when you talk about the Ayurveda has given definite causes of what can cause leukorrhea. From there, we can talk, there's, adhyashan, which is, eating before your previous meal is digested. Then Diva Swapna is one of those. Eating a lot of spices, again, is one of those. Then, drinking alcohol, too much of alcohol consumption, again, is one of them. Frequent traveling, again, is one of those. Then there is, what do we say? There's Diva Swapna, which is sleeping in the afternoon, again, is one of those. So anywhere where your body is not in alignment with your natural clock can be a cause. If we just generalize what all causes are given, so excessive spice consumption, or excessive, erratic lifestyle or dietary patterns, again, can be one cause. Stress can be one cause. Smoking can be another cause. Frequent traveling can be one of the causes. Uh, Mrunal, is it better now? Is my voice okay now?
Oh, it's better. It's better.
My Instagram live is jinxed. Whenever I go live, some other problem is going to happen. It never happens in one go. So, okay, so these are the causes of leukorrhea. If we talk about the Ayurveda, what Ayurveda has given you. So, when we think about the do's and don'ts of leukorrhea, what all things you must do, first we must learn to eradicate the positive factors, because according to Ayurveda, Nidan is something that must be eradicated. Okay, so first line of Chikitsa in Ayurveda is Nidan Parivarjana. Okay, so when you talk about that, uh, Ayurveda says that must avoid the causative factors. So all these things which I've just mentioned, which is, excessive spice consumption, alcohol, then smoking, excessive stress, then there's, sleeping in the afternoon, everything must be avoided. So any girl who tries and comes in alignment with her natural clock, eats well, has a balanced diet, sleeps well, will not be having all these causative factors, and will not be having leukorrhea, which is the pathological leukorrhea. The physiological leukorrhea is something that anyone can have even after following all these things, which is completely normal. Okay, so any girl who's following all these things. So now when we talk about the do's and don'ts, you must avoid all these things. So these are the don'ts. You avoid the causative factor, which are the don'ts of leukorrhea, right? Then when we talk about the do's, what all things you must do is you must follow a balanced diet, a diet which is which your Agni is capable to digest. Appetite is a moving entity. Appetite is not stable. When we talk about Agni and when we talk about, Shuddha, Pipasa and everything, when we talk about all these things, these are all moving entities which would change according to the season. When we talk about winter, when the Bala is good, the Agni is good, the appetite is good, right? You talk about summers, the Bala is low, the Agni is low, appetite is low, right? So when your appetite is a moving entity, every girl who eats as per the appetite is going to avoid the causative factors of leukorrhea and is going to have a good health in general, good hormonal profile, good period cycle in general. Because see, when you talk about hormones, hormones are all about rhythm. Okay. And when you have a perfect rhythm in terms of your daily routine, in terms of your dietary pattern, your hormones are going to be in alignment, right? So that is those are the do's of not having leukorrhea. Or if you have leukorrhea, what all things can one do is come in alignment with natural clock, eat as per appetite, follow a good routine, and taking care of sleep in general, taking care of stress in general are the general guidelines that one must follow. But then what all interventions can be done if we talk about the Ayurveda perspective is Ayurveda has given n numbers of herbs and herbal preparations. So there are single drugs as well that can be used. There are multiple Ayurvedic preparations that can be used. There are multiple therapies and chikitsa which can be done. So if we talk about the shaman chikitsa, where we think of the oral intake of medicines, there are single drugs like there's Lodra, which works well. There's Nag Kesar, works well. There's Palash, works well. Then there is Chandan, works well. So anything which has Shita property and anything which has Stamban property, Shita is opposite of you know already. So anything which has Shita property or anything which has Stamban, so the clogging properties, is going to work well. So these are the single drugs. Then when we talk about the Ayurvedic medicines, although I don't talk about medicines in general, but then there are certain herbs. If anyone who's from the audience suffering from leukorrhea, don't take these medicines all by yourself. Talk to a doctor before taking it, because that way you're just harming your body and that way you're just defaming Ayurveda. So that's just a warning before I mention the names of the Ayurvedic preparations. Again, then there's Pushyanuk Churna, works well, available everywhere, available over the counter. That works well. Then there's, Lodhrasa works well, Chandanasa works well. So all these preparations work. Then there's Parpatis, works extremely well. There's Bol Parpati, works well. Praval Panchamritras works extremely well. So all these things works well when we talk about leukorrhea. Therapy that can be done at home is the Triphala wash, which I think I also have a post. Yeah, so I already have a post on how to prepare Triphala wash and how to use it. So that's something that one can use to make again, when a person is using Triphala wash, that person has to be guided extremely well, because it's, you are washing your extreme intimate part with something, right? And that medicine which you're using for that, or the Triphala churna or the powder that one is using, has to come from an authentic source, has to be made authentically, has to be guided well, how to use, when to use, everything, and what must be the temperature of the wash, what must be the temperature of the decoction that you're using. Everything has to be guided when one is doing that. So to use Triphala wash, again, one person has to just boil Triphala and then let it infuse and let it come down close to room temperature. Let it slightly warm. Then sieve it 2, 3, 4 times so that there are no tiny particles left, and then it can be used to wash. If there's, and it works extremely well if there is curdy discharge, which we call as candida in the modern science, right? So if there's itching, if there's extreme curdy or clotty discharge which is happening, Triphala wash works extremely well. Along with that, one must also avoid fried and fermented food items while being on the Ayurvedic protocol for leukorrhea or candida in general. So this thing is again one thing which can be done. A very simple home remedy which works very well for all sorts of leukorrhea even the physiological leukorrhea sometimes is a little disturbing. Few females have very little discharge, but there are few females who have very high discharge. So even if it's natural, they, face a more discharge during, before or after their cycle. So simple remedy that works very well for even for the physiological discharge is tandulodak, which is where we soak the rice and next
Yeah,
morning
nice water.
that rice water, right? So now I've seen n number of doctors putting up post with white rice, polished rice, and putting picture of that. Although in Ayurveda it's red rice, which has to be used, right? It's shashtikashali, which has to be used while making rice water. So that is again one remedy that works very well. So one person just has to wash 1 tablespoon of rice and then soak it with in 2 cups of water, 1 cup of water. Next morning, you just have to sieve it and have this particular water during noon or empty stomach in the morning. That can be done. That also works very well for leukorrhea. So these are simple remedies and simple herbs and herbal preparations that can be used. But then while before using herbs and herbal preparation, one must always consult a doctor. And Triphala wash again must be guided one. This Shashtika Shali or this is something which can be done. The rice water can be done by anyone. A person who is suffering from physiological discharge but is bothersome, that person can use this as well.
I just wanted to share a thing with you. Actually, I got a patient, means a patient in my college hospital once
Hmm.
when I was in fourth year that time. Sorry, I was in third year that time. The patient gave history about swimming in the pond. Patient was suffering from leukorrhea, severe leukorrhea, I can tell.
Hmm.
Means a thick whitish discharge was very thick and very clotty type was there.
Hmm. Hmm.
So
Hmm.
she gave history of swimming in the pond, and
Hmm.
I asked about the pond water. In that same pond, they used to wash the utensils and their even the
Hmm.
clothes. So I think that can be one of the cause for the village women.
Right, right. Again, intimate unhygiene is again one of the causes that Ayurveda has also mentioned. So if the person is not keeping intimate hygiene, again, that can be a cause for leukorrhea, that can be a cause for candida, that can be a cause for Shwet brother. Yes, that's a very good point, which I
Yeah,
missed out on. Yes. There's one question, how do you use the water? The rice water is for drinking, not for washing.
yeah. Another thing I think that's very common among us doctors, the lady doctors who does the long duties. That is, we can't change our clothes for long time. That's why I think we have the leukorrhea. After some days, we start having that.
Again, right. Yeah. So that's very, very important. During winters, it's completely okay because you're not sweating too much. But then during summers, again, it can be very bothersome. So keeping intimate hygiene is very, very important. Also, I've seen the washes which are generally available nowadays, the V wash and everything, and all people use vaginal douche to wash that area. It's very important that we understand that that area can be of different smells at different point of time, can have different discharge with different sort of thickness, the consistency and again everything. So your vagina takes care of itself. Your vagina will wipe out all the bacteria itself. Your vagina is something which is acidic in nature. The pH of vagina is acidic, right? So your vagina itself would clear it, again and again. No need to use, products or powders that's going to make someone smell good, out there. Or it's not recommended to use a lot of vaginal washes, you using soap and water. Sometimes if you just want to clear off that particular area, little bit of warm water, normal tap water is completely okay to go forward with. But using a lot of products down there is also not something which is recommended. It's not a good practice because you're just putting a lot of chemicals inside there, which is not something which is not the right thing to do.
Another thing I have confusion about that is that wives nowadays, those wives are very available in market. Some companies are selling that wives, vaginal wives. They're selling in the names of these things. So
Hmm.
those things are safe for means this vaginal thing.
No, it's not safe. It's not safe to use for the vagina. Again, these wipes are again very much, fragrant. because they want you to use it, and then you can smell good down there, which is not a good practice, because once you using something like that, you're just using chemicals down there, which is not a good practice. What is a good practice is to use washrooms which are not public washrooms again. So if you move out, take care of the fact that the washrooms that are you using, uh, yes, I will answer that question. So, how to take care of it is, bathing daily, and then washing that particular area with just water on a daily basis. That's one part of the intimate hygiene. Taking bath on a regular intervals, or, on days when you've sweated very much, take bath 2 times a day, because you have had a lot of sweat. So, it's good to take bath again. Then the third thing is to have good amount of water intake. That is also going to clear out that particular area. A person who can have, frequent UTIs again can have vaginal burning sensations as well. So taking good care of that itself is a very good a part of, just that much is enough. Taking, you using vaginal wipes, or using intimate washes or vaginal douche again is not a good option. Uh, how can we treat brother with severe itching? So this is what is itching. Itching again is a symptom of, kandu. What is kandu? Kandu is a symptom of kapha, right? Kandu is because of kapha. So if there's severe shot and kandu both, if there is shot and if there's kandu, that is a symptom of kapha. So if there is severe itching, Triphala vaginal wash works extremely well. Along with that, cutting off certain inflammatory food, cutting off foods that can cause, kapha aggravation, curd, cutting out that is very, very important. Cutting out anything that is heavier to digest is very, very important. So just that much, and then using the herbs and herbal preparations as per Yukti is very, very important. That is how you can treat Shwet brother with excessive itching.
Got another questions. Does cranberry juice help in UTI?
Cranberry juice is just an option. It's something which is going to increase your water intake, and it's something which is rich in antioxidant. Works well, but it's not a treatment. It's good to have. It's just something which is which is rich in antioxidant. Works well, but it's not a treatment again. People who have frequent UTIs must learn to take care of their acidic body. People who have frequent UTIs again have a pittic body, and managing their pitta, which is their basic dosha, works well.
So, thank you, Dr. Vaishali. To have you here was a very honor for me. It was a great session. I think all the
Thank you.
audiences enjoyed the session because got so many questions. And plus, someone told thank you also. Wow. So I think it was a very
Thank you, Dr.
great
Anvisha.
session. I loved it. I love the way you explained about Leucorrhoea and the do's and don'ts and all the symptoms. You just explained it very simple way. Layman can understand it actually.
Thank you,
Thank
Dr.
you.
Anvisha. Thank you so much for having me. I'm sorry about the glitches I had in between. I'm so sorry,
No,
because I'm
no,
jinxed whenever it comes to Instagram lives. I can never do it in one go. So Instagram hates me. So I'm sorry for that. But thank you so much for
that's
having
good
me.
internet.
Okay. Thank you so much,
Okay.
everyone. All right,
Yeah.
I'll leave. Bye
Ending
bye.
the session.
Yeah.